Hi, my name's Michelle Karam. I'm 33 years old and I'm pretty eager to participate in this project because I have very extensive experience with the mental health system. In terms of when my mental health problems began, I honestly just have to say that I think I was born with it. When I was a child, I used to bang my head on the floor. Um, I remember being in elementary school and asking my friends to play suffocate me. Um, I would play with ropes in our backyard and knives, and I wasn't actually mutilating myself at that time, but I would be fantasizing about it. So that's about elementary school. Then I remember things being okay until puberty hit. And once puberty hit in about seventh grade, ever since then, I've never really made a comeback. I just became incredibly depressed. And I wasn't getting any help for it. I was suffering in silence, pretending everything was okay because I didn't want to bother anyone, and my parents weren't the type that would react helpfully in that situation. So, my first suicide attempt was when I was 17. Actually, was at my parents' house. And it was, a typical kind of naive suicide attempt. I probably took a bottle of ibuprofen and then I cut myself up. And I remember my mom waking me up in the morning and her being upset because I had gotten blood all over the sheets, and her being upset because I now might need help, which was, I guess, something she didn't want to have to deal with. So, I continued for the next year, as I had before, and then I was introduced to drugs. I found myself doing drugs starting at 17 or 16 with drinking and weed, but got into some really hard stuff once I was 18, and that was 100% to self-medicate. Um, we're the circumstances, I guess you could say, when I first started like getting help are when I was 18 in college, and I tried to kill myself again. I was using heavy drugs at the time, heroin and cocaine, which I've continued to struggle with for 15 years. Um, but I was put in the psych ward for the first time when I was 18. I don't know, I probably had my stomach pumped or something. I remember that first time being really scared. Like, it felt like the end of the world that I was going to be put in the psychiatric hospital, which I think is probably normal. Um, Unfortunately, since then, I've probably been in the psych hospital 8 or 9 times, so it no longer scares me. But that first time, I just remember being horrified. And I just kept thinking everyone's going to be mad at me. Like, it wasn't about me, it was about how people were going to react to me because I didn't want to be a burden or what have you. Um, I can say when I did ask for help, well, I never asked for it actually, but after certain behaviors, I was required to attend counseling, individual psychotherapy, as well as an outpatient drug rehab. I think those were my first real experiences with treatment. Um, and I didn't really find them very helpful. They were addressing a lot of the drug problems because that had become the surface problem. because I was using it to cover all of my deficits emotionally. Um, and I trying to remember. Well, there's so many incidents that I've had that have been acute and like near death experiences, and just really done a lot to hurt myself. I did self mutilate for many years. I haven't done that in probably 2 years or so. Um, I can say that in the past years, when I have taken responsibility for my condition, supposedly diagnosed with bipolar 2, and I had been diagnosed with borderline personality disorder when I was younger, but I think I've kind of grown out of that, and right now I believe and see my problems as being directly related to the bipolar and the drugs. Um, but I do remember when I was in the hospital one time and I did ask for help. Um, it was an unusual situation. I was probably about 24. And I'd been in about a 3-year relationship, which was never healthy, but I was madly in love and what have you, and it didn't work out. She broke up with me basically because of my drug use, but it was a really bad breakup, and after that, for the first time in my life, I began to experience hallucinations. I had, what they call a psychotic breakdown, which I think is similar maybe to a nervous breakdown. But I remember the first time being in my new apartment in my room, and I started to hear an echo. Everything I said, I heard an echo of. And I didn't know that it was in my head. It just seemed so real. So I went for a couple months, just acting beyond crazy. I would get on the subway and literally start fights with people on a very regular basis because I could swear that they were talking about me. So there was a lot of paranoia, a lot of public crying and public talking to myself. It was really bad. And it didn't help that I didn't know that it was mental illness. Until one day I was seeing my psychiatrist at the time, and he walked me over to Beth Israel and had me committed. I think that was probably the third time I've been in the hospital. I do think Beth Israel had a helpful program. I've been to about 5 different hospitals, and Beth Israel sticks out to me as probably the best one. With Kings County and Woodhull Hospital being at the very bottom, I do not recommend getting any kind of treatment there. And I mean, as for being listened to and respected, I find that inpatient in the hospital, that is hard to come by. Inpatient hospitals, I find, are just holding grounds for doctors to play with your medication and then discharge you. They're really not about therapy or, looking really at the deep issues. None of the hospitals I've been in have had that as a focus. Everything has just been about medication and making sure you don't immediately hurt yourself or somebody else. One thing sticks out as a woman specifically was, again, it was during the Beth Israel stay. I remember my first day there, one of the patients just had hypersexuality. He was sick, and he pulled his dick out and started masturbating in front of me. And I think I had told somebody on the staff, but they didn't do anything. I mean, they probably talked to him, don't do that. But I don't know. I have mixed feelings. I don't know what I would have wanted them to do with that, because he was very sick. Um, but that was probably the only time I felt that I personally was kind of offended by a male who was, sexually harassing me. And but in other cases throughout the years, I've definitely felt that other male patients, again, there's hypersexuality and will make me uncomfortable with things that they'll say, but nothing in terms of action. And never was staff inappropriate with me. The worst is just that staff seem very disinterested, but never did they, cause me any harm. Um, on a daily basis, my mental health condition affects me kind of catastrophically. Um, Up until about 3 years ago, I'm a licensed social worker in New York State, and my passion was social work. I had a couple good jobs where I worked as a therapist with people who had AIDS, people with drug addiction, a really tough population, but I was really good at what I did, probably because of my own past, but those jobs meant the world to me. And the first one, I got fired because it was when I was delusional and psychotic and started attacking my coworkers, not physically, but I think it was clear that I was either, psychotic or on drugs. And at that time, it was just the psychotic issue. So they let me go. But at that time, I was still in the mode of like, okay, next job, because that's how I was taught as I grew up, was just you work hard, work ethic. And so after a few months, I nailed another job, which was the best job I've ever had. Again, I was working as a therapist. I had individual clients and also group clients. And once again, that job ended with me, unfortunately, having a nervous breakdown, which I think they now call a major depressive episode. I don't know, but after about a year, in all my jobs, it seemed like about a year was as long as I could last. This was very highly emotional work. I was dealing with death a lot, which I didn't know how to deal with, I see in hindsight. And I was just stuffing a lot. I wasn't even really talking about it in therapy. It was like a non-issue until I had my nervous breakdown. And when I was meeting with my boss, I started banging my head on the wall, talking about suicide, and they fired me and called 911 and had me put into Kings County Hospital. That was about 3 years ago. And I've had one or two jobs since then, but I really feel like that experience at the last job kind of traumatized me, and I feel so limited in terms of what work I can do. I suffer from a little bit of agoraphobia. I can't really ride the train. I have a lot of things that make it difficult for me to work. And I want more than anything to be out there working. Just on a side note, when I was starting my career at 22, I worked in a psychiatric hospital for 5 years. So basically, I've been the caretaker and the receiver of help throughout my whole adult life. And actually, at that last job, which, I have so much remorse over losing, and I feel today like if I could just get that job back, everything would be okay. But while I had that job, I'd had it probably about 6 months, and I have absolutely no idea why I did this, but it was actually New Year's Day, and just out of the blue decided to kill myself. And I lived alone at the time, so no one was gonna come find me or rescue me. I took like 10,000 milligrams of Seroquel, um, and took whatever other pills I had, and I was so sure that that was it. Um, as the universe would have it, I actually had a date scheduled for that night with an old flame, and I had forgotten about it. And I guess, I didn't call her and plan the date out or what have you. And she actually just intuitively came to my house and found me practically dead. I was in the ICU for probably 3 days. I suffered a brain injury from it, um, because I was in respiratory failure for too long a period of time, which means my brain cells started to kill themselves. And today, I still feel the effects of that somewhat, just in that my memory is very poor. But I feel like this is very random. I'm tangential. My mind just sometimes thinks this way, and on this project, its goal is very close to my heart. So I have so much to say that I could never say it all. So I'm just kind of bouncing around. But I wanted to mention the fact that I did get ECT, which is electroconvulsive therapy. That was probably about 2 years ago. I got it for the first time. Um, I got it because I chose to get it. It was after I got out of Kings County and I didn't have a job, and I remained suicidally depressed. And I decided that I did want to live. I wanted to live, but of course I didn't want to live the way I'd been living. So I took the most drastic measures that I could and got myself ECT. I don't remember how many treatments I had the first time, but the huge side effect that I've felt from it is that my memory is pretty shot. It's not horrible, but people will tell me things and I'll literally have no memory. It's as if they could tell me anything and I would have to agree because I don't remember things. Um, and I went back and got ECT a second time because my symptoms started to return. And then I just had it for the third time, probably 6 months ago or so, when I ended up inpatient psych again. But I'm really happy to say that I am not suicidal anymore. And no matter what anyone says about it being an extreme treatment or just the myths people have about it from its initiation, I would argue all of that. And I strongly believe I very well may not be here today if I did not get that procedure. Um, and I guess coming towards the end of the interview here, I feel like I should have finished about 5 minutes ago. But there was a question, I guess, in terms of what I really do to cope with my emotional struggles. Unfortunately, I still battle with drugs, and it's the worst coping skill available, but I do still use that. I write in my journal, I go to my therapist, I go to my psychiatrist. Um, I go to the hospital if and when I need to. If I become suicidal again, I will willingly take myself to the hospital because I don't want to die. Um, but oh, acupuncture has become a big coping mechanism for me. Um, I don't know. I guess I'm still kind of struggling with, learning to cope the best that I can. So, um, what I think the main problem with the mental health system is that as far as psychiatrists go, most of them really don't give a shit. They are like any other doctor, and they mostly see you as a number, and they have no real interest in getting to know you. That's the therapist's job when you get a therapist. But through the years, I've certainly seen over 10 different psychiatrists. For whatever reason, I would leave and start. Right now, I have the best psychiatrist I've ever had, and he's amazing, and he helps me a lot. But problems with the mental health system is definitely this whole medical model and the way that doctors subscribe to it, and they are just usually very cold. And if you're in the hospital, you never even see them. Like, I could be in the hospital for 5 days and see my psychiatrist maybe twice for like 5 minutes each time. So, I mean, I think that's a huge problem. And I mean, inpatient hospitalization as a whole has a long way to go. In my mind, I think they should be offering a lot more therapeutic services than they are, instead of just being a cage for people to stabilize their medication. Um, and I guess I'm gonna gonna say over and out at this time because I think I've said way more than I needed to. But I could talk at you for 20 more minutes because of all the experiences I've had with mental health. And I finally see it as a disease, and I try to be hopeful. And I lived 30 years of my life being suicidal actively. And just these past 3 years that I have eradicated my own suicidality, and that alone is a huge, huge step. So, um, I can't, I can't say whether I'm in a good or bad place. I'm just trying to do my thing every day. Um, Hope this answers any questions. And if need be, if there's any specific topic or something, I could certainly talk on it, because this is a great project, and it just totally hits me because it's just the subject of my life. Thank you. Bye.